Hello everyone, welcome back to my YouTube channel. Today we are going to talk about occipital bone, and here at the side you can see the diagrammatic or schematic representation of skull, and the orange color bone at the back region or posterior region is occipital bone. Now let's start the topic with the introduction. Occipital bone is single large bone located at the back and base of skull. It plays a crucial role in protecting the brain, forming the structure of cranial cavity and allowing passage for the spinal cord. Due to its position, it is essential for head movement, nerve transmission, and sutural structural support of the skull. Let's talk about structure and location of occipital bone. It is situated at the posterior part of cranium. Its strategic placement allows for the connection between skull and spinal column. Occipital bone features a large opening called the foramen magnum through which the spinal cord passes, linking the brain to the rest of nervous system. This makes it vital component in neural communication. Now let's talk about articulation. Occipital bone articulates with several other bones including the parietal bone as you can see here in the diagram, temporal bone you can see in the diagram, sphenoid bone, and the first cervical vertebra that is also called as Atlas vertebra or C1. Now let's talk about anatomical features of occipital bone. Occipital bone has several defining characteristics. These include foramen magnum, that is a large opening at the base of skull that allow passage of spinal cord and blood vessel. Next feature is occipital condyle, that is rounded protrusion that connect with the first cervical vertebra enabling head movement. Next feature is external occipital protuberance, that is a raised area on the back of skull serving as an attachment site for neck muscle. Next feature is lambdoid suture, that is a joint between the occipital bone and parietal bone. Next feature is inferior and superior nuchal line, that is ridges on the posterior surface of bone assisting in muscle attachment. Now let's talk about function of occipital bone. Occipital bone serves several essential roles in human anatomy. The first function is brain protection, as it shields the posterior portion of brain including the cerebellum. Second function is spinal cord passage, as it contains foramen magnum allowing the spinal cord to connect with the brain. The next function is head movement support, as it works with the Atlas vertebra to enable nodding and rotational movements. Next function is muscle attachments, that provides a structural support for neck muscle involved in posture and movement. Next function is cranial stability, as it forms the back portion of the skull and gives it integrity. Now let's talk about clinical significance of occipital bone. Occipital bone is crucial in head trauma assessment. Injuries to this region can affect vision, coordination, and neurological functions since it houses critical brain structures. The first is occipital fractures that can impact the spinal cord leading to serious complications. Second, additionally to the occipital neuralgia, that is a condition that causes severe headache arising from irritation of nerve passing through this region. This bone is also significant in surgical procedure involving neurosurgery and spinal intervention, where surgeons must carefully navigate the occipital region to access the brainstem or upper spinal cord. And now let's talk about conclusion of whole of this lecture video. Occipital bone is essential structure in the human skull, providing cranial protection, spinal connectivity, and head movement support. Its unique feature and clinical relevance make it a crucial area of study in anatomy and medical sciences. Understanding its role is key for medical professionals, especially those working in neurology, orthopedics, and surgery. And this was all about occipital bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.